this is Sangeetha from MedCity International Academy. I'm here with another OET Speaking role card, and today we will see how to enact a community health cleaning setup. With me will be Madan, and he will be taking up the role of the nurse. Often students are confused when it comes to community health setup. How do you begin the conversation? What are the things that you need to keep in mind? And how do you approach the tasks? So many questions that they have in mind. So this is a sample so that you can have a look at how it can be performed. Remember, this is just one instance or one method that you can use. There are various other ways in which you can approach this particular card. Here, as I read out the card, you will notice that there are around 6 tasks for the nurse to perform, which is quite a long list of tasks. So there is a high possibility that a candidate receiving this card would focus more on just the task and not pay attention to the patient or the carer that the nurse is talking to. That is a dangerous thing to do. Remember, whether you have 6 tasks to complete, whether it is 4 or even less, your priority should be on how smooth the communication goes. Of course, you have to include all the tasks if possible, and there should be a relevance to the conversation. But that does not mean you don't respond to the patient's or the carer's concerns and questions. Give ample time for the person you're talking to speak. Depending on their responses on their queries, you need to continue your conversation. You can always use methods and strategies to divert the person you're speaking to back to your conversation so that you can follow the tasks one by one. At the same time, it also becomes important to give ample or the right kind of response to the person you're talking to. So here you will see how Madan deals with a young mother. She has 3 children, all very young, with the problem of head lice. Let's have a look at the conversation. So this is Madan's card. Madan, your setting is a community health clinic. A young woman, the mother of 3 children, aged 3, 4 and 6, has come to the clinic and tells you she has just discovered her eldest daughter has head lice. She is upset and embarrassed and assures you she always washes the children's hair regularly. She has no experience in dealing with the situation as it has never happened before. And your tasks are: 1. Reassure the patient and explain that head lice are contagious and anyone, no matter how regularly they wash their hair, can get head lice. 2. Suggest the mother contact any school or kindergarten her children attend, as it's quite probable other children are also affected.
Okay.
Next, recommend and explain the use of a head lice comb. 4. Suggest the mother visit the local pharmacy to obtain a herbal product with natural pyrethrins.
Okay.
5. Say that because head lice spread when people play, cuddle or work together, it is important to check the whole family. And your last task is to offer to provide the client with a detailed leaflet on treating and controlling head lice.
Okay.
So you have 3 minutes to prepare on the card.
Okay.
Here is a paper, your card and a pen.
Okay.
I'll stop you when your time's up.
Thank you.
You can start your preparation now. So Madan, you have 5 minutes for the roll card.
Okay.
You have to return the card once your roll card is done.
Okay.
Do not mind if I stop you because that will be the end of the 5 minutes.
Thank you.
So can we begin the card now?
Yes. So, good morning.
Good morning.
My name is Madan. I'm one of the nurses working in this community health center.
Okay.
Can I know your name and what is the purpose of your visit today?
Yes, Madan. My name is Sangeetha.
Okay.
I'm here with a very embarrassing problem. I have no idea how to tell it to you.
Okay. Maybe you should tell me, because then only I can just help you with the problem.
Yeah, see, I have 3 daughters. They're all very young.
Okay.
They're 3, the other is 4, and the
Okay.
eldest is 6 years old.
All right.
I just noticed last week that my eldest daughter has head lice.
Okay.
I've never had this problem, with myself, or
All
this
right.
is the first time, my children have this problem. So
Okay.
I'm a little worried.
Yeah, I understand that head lice is something is worrying you a lot right now, but I want to assure you that there is nothing much to worry about it, because we have an active treatment. We have a particular treatment for this head lice, and we can avoid this.
But is it something that I should be scared of? I mean, how does this really happen?
Yes, I was about to say that there is nothing to be scared about this. With the treatment, it can be treated completely. Okay. And as it is contagious disease, like it can spread from one among your children or to
really?
others. Yes, so we need to take some precautions.
But see, Madan, I don't know how this happened in the first place.
Okay.
You see, they're all like pretty daughters that I
Yes.
have. I wash their hair regularly.
All right.
They have like quite thick, long hair.
Okay.
So I don't wash it every day, but
Fine.
every 2 days I make sure I wash it.
Okay.
It's dried and it's combed and tied, and I don't know what went wrong.
I understand that you have taken all the hygienic measures you can take to maintain their hygiene.
Okay.
But I want to tell you that even with all these precautions and all the measures you take to keep lice away, still there are chances that head lice can occur, and maybe many reasons could be there. Maybe.
Can you tell me how?
Yes, as maybe your children is going to kindergarten or the school right now. Am I correct?
The eldest one, yes.
Yes. So maybe there might be someone who might be having head lice in their school. So when they cuddle or when they play together, so there are chances that head lice can spread, and it can come to your daughter.
And
it can occur. It can happen even after taking a lot of precautions and a lot of hygienic measures. So as I told you, there is an active treatment for this, so you don't have to worry so much. And with the treatment, with the precautions, it can be completely cured, or we can take this out.
Active treatment, as in, is it something that painful or some procedure?
No, not at all.
Okay.
It's just we have a special comb you have to comb the hair, so it's just called head lice comb.
Okay.
It's a specialized comb which we are going to provide from here right now.
Okay.
So it's going to be helpful for you, and if that is just a primary treatment, and maybe after that we are going to give you some herbal product with natural pyruthins, which is it is one of the treatment options you got, and maybe with that everything will be okay.
But how do these really help? I mean, I don't get it.
Fine, you just have to apply this while taking shower, and you have to comb it. So once you do this, I think most of the head lice will be dead, and again if you repeat once or twice, I think most of the head lice will be over. Okay. So, and there are many other measures I have to tell you. So like as I told you, it is a contagious disease. I mean, it's contagious where there are chances it can spread to other members, maybe other members of the family, other friends, other children in the school.
Okay.
So it is good that you just ask your school nurse about it.
Madan,
yes.
What if once all the lice come out of our head?
Yes.
Is there a chance that it can come back again, and how do I make sure that it doesn't?
Fine. Yeah, of course there are chances, because if the the infestation can happen again if someone else has the same problem in the school, and that can happen. Okay. So we just have to keep looking at it, and we should just monitor whether the patient, your daughter, has a head lice or not.
Okay.
So if she has, as I told you, that we have a herbal medicine as well as with the comb, we can just sort this out. But I think the more importance to be given for the precautionary measures, as you have 2 more children, and as she is school going. So if you can contact the school nurse and report this to school nurse, I think this is going to be very helpful for stopping this. And also this can happen.
So
please.
Madan, thank you. That's the end of your 5-minute time.
Okay, thank you.